Mothers to be who take antidepressant pills during pregnancy are more likely to have children who suffer language disorders, according to new research. The study showed mums who bought antidepressants at least twice during pregnancy had a 37% increased risk of speech or language disorders among their children compared to mothers with depression and other psychiatric disorders who weren't treated with pills. Professor Alan Brown, of Columbia University's Mailman School of Public Health in the U.S., said, "To our knowledge, this is the first study to examine the relationship between maternal antidepressant use and speech or language, scholastic, and motor disorders in offspring." The study benefited from large sample population and followed the children beyond age 3. The speech or language disorders included expressive and receptive language disorders and those involving articulation of sounds. Professor Brown said selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine, citalopram, paroxetine, sertraline, fluvoxamine, and escitalopram, are absorbed by the placenta and enter the fetal circulation. They are also increasingly used during pregnancy. Based on a sample of 845,345 single-live births between 1996 and 2010 taken from national registries in Finland, the exposure groups were classified as mothers who bought SSRIs once or more before or during pregnancy, those diagnosed with a psychiatric disorder 1 year before or during pregnancy but did not buy antidepressants, and mothers who neither bought antidepressants nor were given depression-related diagnoses. Since the extent of SSRI exposure was greater for mothers with more than one SSRI buy during pregnancy, Professor Brown and colleagues also examined exposure by number of purchases, and conducted 2 supplemental analyses to determine whether associations between maternal purchases of 2 or more SSRIs and the risk of speech or language disorders in offspring were further affected by the severity of depression. The results, published online by the journal JAMA Psychiatry, did not change appreciably and remained statistically significant. Watch more videos at video.5la.net.